Next in our series is the small intestine. Here's where most of our absorption will take place. We will see now in the small intestine a release of a sodium bicarb which needs to neutralize the acid. If we take coffee with a meal, that will cause the small intestine to release its sodium bicarb from the pancreas prematurely. It will then have to do it again at the end of the meal. This is why taking coffee with the meals is the number one cause of pancreatic cancer. Because we're asking the pancreas to release its sodium bicarb too fast. It should take 5 to 6 hours to recover, and we're asking it to do it within an hour. This creates a problem, not only for our digestion, but a problem for the pancreas. The small intestine now blends in the bile, which also helps to neutralize the acid, blends in the sodium bicarb, and a host of pancreatic enzymes are now going to escape into our small intestine to help facilitate our digestion. The digestive process in the small intestine will be an electrical process, as there are electrical brush border effects of the fiber in our diet, which will create a little electrical tension to help nutrients to come into the small intestine. The different enzymes, etc. The small intestine is a fantastic chemical absorptive plant where we are now going to be able to break things into our nutrition. We need fiber, we need nutrients, and we need natural. We need the stomach to do its job for the small intestine to properly do its job. Now, throughout our body, we take a look at different organs like the heart, and we know the relative size. And if the heart starts getting too big, we know that's a cause of disease. We know that that's a problem. If we see that the liver is swelling, we say that's disease. If we see the spleen is swelling, that's disease. So we can see these different diseases. But when the small intestine swells, we don't think about it that way. Why? Because most people don't obey the rules of the stomach. They don't obey the rules of the small intestine. Thereby, their small intestines increase. From the width of the ascending colon to the descending colon, the width of our patient should be no more than 2 of their palms, 2 of their fingers. If that is the case, and they have this, then that is the normal size of the small intestine. In fact, a little bit smaller than that, actually 1 palm with 3 fingers would be the ideal size of the small intestine. But in many of our patients, we're going to see sometimes it's 3 or 4 palms, and it has become excessive. The small intestine has swollen in size. It has distended. It has been pushed by breaking of the rules of the stomach, creating a burden on the small intestine. It has to swell in order to do the job of the stomach and the small intestine. We're going to create more and more of a problem. Most of the problem with obesity in America today is not just fat, but it is distension of the small intestines. However, fat is very important. But we're going to have to work with the small intestine and understand the small intestine and find ways that we can take the cure and get back to our natural health.